So hi everybody. So I am Sridharan, assistant professor from SNS College of Physiotherapy. In this video, we are going to see about the topic tetanus. So this presentation just covers what is tetanus and how it is caused and how our amount of prevalence is causing around this world and as well as around the India, and it also covers pathology, diagnosis and then treatment. So what is tetanus? So tetanus is a disease. It is caused by a bacteria called Clostridium tetani. So it is a bacteria which causes tetanus, and it is the nature of disease. It is an acute and it is also a fatal condition. If the tetanus is caused by for a patient or a person, if it is untreated for a prolonged time, it leads to a fatal, which means death. Then the main symptom of the tetanus is for muscle rigidity. So what is muscle rigidity? The muscles are get stiffened. In the normal term, it is muscles are getting stiffness. Muscle stiffness is known as muscle rigidity. Spasm. The spasms is a muscle get into a cramp like nature. It is called as spasm, and also a lockjaw movement. So the jaw of a person is get locked. So if the tetanus is caused for a person, that person is cannot able to open or properly open or close their jaw. So these are the main symptoms of the tetanus, and the tetanus is caused by Clostridium tetani. So etiology. So the etiology means the causes is known as in normal term the causes is known as an etiology. So how this tetanus is caused by? It's mainly caused by a bacteria called Clostridium tetani, and in this the nature of bacteria is it is an anaerobic. So this Clostridium tetani doesn't need any kind of oxygen or carbon dioxide, so it is known as anaerobic. And the nature of tetanus bacteria, it is an gram-positive bacteria, and it is also a spore forming. The spores are generally that formed in the fungus infected breads that in white moldy structure we can see able to see. So that is called as spores. So like same, this tetanus also is an spore forming bacteria. In environmental side, it majorly presents in the soil, and it majorly presents on also the dust particles, and also commonly seen in the animal feces. Okay, so it majorly presents in soil. No, if the person get injured leg, and if he gets into an open wound and placed into an ground which is majorly present of an Clostridium tetani, so the tetanus bacteria enters through the open wound and it starts to affect the person. So the majorly the causes for the bacteria Clostridium tetani, it is caused through the soil if the person consists of an open wound. Okay, then so that is the next point we going to see about. So how could the Clostridium tetani just enters into the body? So the Clostridium tetani just enters through the wounds like cuts, and as well as also an burn injury. Superficial burn injuries can also lead an open door for the tetanus bacteria. And last one, it is also a toxic action. So it also blocks the inhibitory neurotransmitters such as GABA and as well as also glycine. So these are the two neurotransmitters mainly helps in the inhibits the neurotransmissions. So epidemiology. So in medical term, the epidemiology represents the prevalence. So how much amount of this tetanus disease causes around the world and as well as across the nation. So in this presentation, the high risk areas are mainly the incidence of the highest in developing countries, and as well as also the neonatal tetanus causes and majorly in death in the infant cases. Okay, so majorly as a global impact, this tetanus is highly causative factors are mainly present in the developing countries. So for example, India is also in one of the developing nations. So majorly India is also have a common prevalence for the tetanus infections, and as well as the neonatal tetanus is one of the major factor which causes death in the infant children also. So the prevalence and the the vaccination. So in around worldwide, about 1 million cases were be annually before the vaccines. Okay, so around worldwide, the before giving vaccinations itself, the cases were be recorded around 1 million cases, and according to the WHO in 2022, so the 213 million vaccines were be given across the globally towards to control the tetanus infection or disease. Then in this, and we also can underreported the common due to poor surveillance. So due to poor surveillances, it is also one of the major risk factor that we are risk of reducing the prevalence or risk of reducing the common causes across the worldwide. Also and one of the risk factor for the tetanus which is infecting throughout the world. So in this video mainly sees about the definition of the tetanus and etiology and as well as epidemiology of the tetanus. So thank you. We can see about in the next video.